Imagine your heart beating more than 1 lakh times every single day. Now think about this. What stops it from rubbing against the lungs every time it beats? What keeps it fixed in the chest even when you run, jump, or change the posture? And what prevents it from suddenly stretching too much when blood volume increases? The answer is just one, that is pericardium. Pericardium is the protective cover of the heart. Pericardium is one of the favorite university exam topics. Examiners commonly ask what is pericardium, what are their layers, functions, and differences between fibrous and serous pericardium. And clinically, conditions like pericarditis and pericardial effusion, cardiac tamponade, all depend on the understanding this anatomy. What is the pericardium? So, first of all, what exactly the pericardium? It is the fibroserous sac, and it surrounds the heart and root of the great blood vessels. And think of it little like a protective bag around the heart. It is the protective bag around your heart. Just as a mobile phone is protected by its cover, heart is protected by the pericardium. It is located in the middle mediastinum and the central compartment of the thoracic cavity. Students often forget the location. That's remember the heart is middle mediastinum and also pericardium in middle mediastinum. Now here's the first concept student confused that how many layers does the pericardium have? Only two. First is fibrous pericardium. It is the outer layer. It is thick, tough, and made up of fibrous connective tissue. Its main job is protection. And the second one is serous pericardium. It is inner layer. Unlike the fibrous layer, this is one of the thin and forms the double layered sac. Now serous pericardium is divided into two parts. That is parietal lines of inner surface of the fibrous pericardium and visceral layer that directly covers the outer surface of the heart. And remember the sequence: fibrous pericardium, then parietal serous layer, then here is the pericardial cavity, and visceral layer. This is the visceral layer, and this is your heart here. But why do we even need this covering? Let's understand each function logically instead of memorizing this. First, protects the heart. It acts like a shock absorber and protecting the heart from external injury. And second one, it restricts the excessive movement. If the heart were freely hanging inside our chest, every body movement would cause the excessive motion. The pericardium anchors in the plane. Then the prevents overexpansion. Suppose blood suddenly increases. Without pericardium, the heart could overstretch, and fibrous pericardium limits the excessive expansion. Fourth one is prevents the kinking of great vessels. It keeps the root of great vessels properly aligned so blood flows smoothly. Then fifth one is reduces friction. Every heartbeat creates movement. The smooth serous layer reduces the friction and allowing the heartbeat beat effortlessly. Sixth one is barrier against the infection. If the infection develops in nearly structures like lungs and pleura, the pericardium acts as a protective barrier, reducing the spread to the disease to the heart. Here are the subdivisions of pericardium. These are the differences between them. These all differences I will explain you in one diagram. That is, this is our heart, and at the outermost layer it is the fibrous pericardium, and inside it is a serous pericardium. Inside visceral layer, that is the epicardium, and this is the parietal layer. This is the diaphragm. Here we can see anteriorly it connects to upper and lower ends of the body of the sternum, and posteriorly by principal bronchi and esophagus, and each side mediastinal pleura, because here lungs are present and here mediastinal pleura is present. And here inner layer or visceral layer pericardium is fused with heart and except along the cardiac grooves or where it's separated from the heart by blood vessels. It is closely related to heart except at the blood vessels present in grooves of the heart. Let's discuss about the pericardial cavity. Now, don't imagine it is as a large empty chamber. Under normal condition, it's only a potential space, meaning the layers are almost touching each other. Inside the space, there are about 15 to 20 ml serous fluid, and this fluid is why so important. Think about the rubbing your palms together without a water. friction increases and little water and they glide smoothly. Exactly the same thing happens here. The serous fluid acts as a lubricant, allowing the heartbeat thousands of times every day without friction. Now, the what structures are enclosed within the pericardium? Pericardium, that is the contents of pericardium. The most obvious one of the is the heart, and along with this, the coronary arteries, cardiac veins, and nerves. In addition, it encloses ascending aorta, pulmonary trunk, lower half of the superior vena cava, terminal part of inferior vena cava, and the terminal parts of pulmonary veins. Think of the pericardium as a protective bag containing the heart and roots of great vessels. Every structure in the body needs its own blood supply, and the pericardium is no exception. Fibrous pericardium and parietal layer of the serous pericardium receives blood mainly from internal thoracic artery, musculophrenic artery, and descending thoracic aorta. Veins accompany these arteries and drain into their corresponding veins. Usually, examiners ask the arterial supply rather than the venous drainage. These are the main arteries. Now comes to the one of the most important clinical concept, that which part of pericardium feels pain? Fibrous pericardium and parietal layer of the serous pericardium supplied by the phrenic nerve, and that means they are pain sensitive. But the visceral layer, also called as epicardium, receives the autonomic nerve fibers from the cardiac plexus. It's not the pain sensitive. Why should remember this? Because the pericarditis, the pain arises from the parietal pericardium, not from the visceral layer. This is one of the favorite university viva question. Parietal pericardium supplied by the phrenic nerve, and that is pain sensitive, and visceral pericardium, that is epicardium, that is supplied by autonomic nerves, and that are the pain insensitive. Next, we will see about the pericardial sinuses. Pericardial sinuses are here small recesses or passages formed by the reflection of the serous pericardium around the great vessels. Think of wrapping a gift, and when the paper folds around the edges, small pockets are formed. And similarly, when the serous pericardium folds around the roots of great vessels, two sinuses are formed. There are only two pericardial sinuses, that are transverse sinus and oblique sinus. This is very commonly asked university question. How are they formed? Look carefully. The roots of the great vessels. The serous pericardium forms the two tubular reflections like this. Two tubular reflections. The arterial tube surrounds the ascending aorta and pulmonary trunk, and venous tube surrounds the superior vena cava and inferior vena cava and pulmonary veins. The passage between the two tubes forms the transverse pericardial sinus, and during development, as the pulmonary veins separate from each other, another recess develops behind the left atrium. Becomes the oblique pericardial sinus. So we will see the transverse sinus in the deep. Here is a theory for the development of the sinuses. Transverse sinus is a horizontal gap and between the arterial and venous end of the heart. Here we will see the boundaries of the transverse sinus. Anteriorly, the ascending aorta and pulmonary trunk, and posteriorly by superior vena cava, inferior by left atrium, and superiorly by the bifurcation of the pulmonary trunk, and on the both sides it opens into the main pericardial cavity. Here's the one clinical importance, that this is one of the favorite viva question, and during open heart surgery, the surgeon passes the finger or a clamp through the transverse sinus to place a ligature around the ascending aorta and the pulmonary trunk. This is the temporarily controls the blood flow during surgery. Hence, it is so important point for our exams. Oblique sinus, now let's understand this. Unlike the transverse sinus, this is a blind-ended recess located behind the left atrium. Here we will see the oblique sinus. Anteriorly, it is related to left atrium, and posteriorly by the parietal pericardium at the right pulmonary veins and inferior vena cava, and the left side left pulmonary veins, and superiorly by reflection of serous pericardium around the pulmonary veins. Inferiorly open into the main pericardial cavity. Its function is simple, that it allows the left atrium to expand freely during filling. Let's see, this is the diagram for this. It is transversely present behind the heart, that is the transverse sinus. This is the oblique sinus. between these inferior vena cava and there is a SVC. These are the pulmonary veins. And here is the oblique sinus. From above we can see behind the left atrium. This is the right atrium, and these are the pulmonary trunk and ascending aorta. It is important in surgery, and this is the oblique sinus. Let's see the clinical points one by one. Pericarditis, because this is we have seen already. Pericarditis is the inflammation of pericardium. What happens if pericardium becomes inflamed? Since the fibrous and parietal pericardium are supplied by the phrenic nerve, inflammation causes the sharp chest pain, especially during the deep breathing. Second one is pericardial effusion. Normally, the pericardial cavity contains only 50 to 20 ml fluid, and if the excess fluid accumulates, it is called as pericardial effusion. As the fluid increases, compresses the heart and making it difficult for the chambers to fill properly. On the chest X-ray, large effusion may produce the classic water bottle heart appearance. On the radiological X-ray, like a bottleneck, this is our heart, and like in X-ray, you can see like bottle. Next one is the pericardiocentesis. So, how do the doctors remove the excess fluid? By the procedure called pericardiocentesis. By the procedure, a needle is inserted into fifth or sixth intercostal space close to the sternum near by the xiphoid process to drain the fluid while avoiding the injury to the lungs and coronary vessels. It is the life-saving emergency process. Fourth one is cardiac tamponade. That is, now imagine your fluid keeps increasing and eventually the heart is squeezed from all sides, and this is called as cardiac tamponade. And let's understand the sequence. That fluid accumulates inside the pericardial cavity. Heart chambers are compressed and they cannot fill properly during diastole. Less blood is pumped out, cardiac output falls, and blood pressure drops. This is the medical emergency because untreated tamponade can rapidly become fatal. Let's do the rapid revision. That two sinuses are present, transverse and oblique. Transverse sinus lies between arterial and venous ends of the heart and important in the cardiac surgery. Here is the transverse sinus. Oblique sinus is blind recess behind the left atrium, and pericarditis causes severe chest pain because pericardium is sensitive to pain. Pericardial effusion is excess fluid in the pericardium cavity. Severe effusion causes cardiac tamponade, and emergency treatment is pericardiocentesis. And here is one MCQ for you. Which nerve carries pain sensation from fibrous to pericardial, fibrous and parietal pericardium? That is the phrenic nerve. And congratulations, you have now understand the pericardium conceptually, from its layer and cavity to the pericardial sinuses and all the important clinical correlations. If this lecture helped you, and try to memorizing it and subscribe because we are completing another topics also. Thank you.